Okay, about the developmental stages of disease. Another video lecture of mode of action of medical microbiology from microbiology with Shagni. So in that video tutorial we are going to discuss about the 5 stages that you will find in case of every disease, whether it will be acute or chronic. Okay, so these stages take place once the invading pathogen elude host defense. So let's try to understand with the help of this graph. Okay, so here there is the number of microbes in y-axis and time in x-axis. So the first step is the incubation period. Okay, so incubation period is the time frame between the initial infection and the first symptoms of the disease. Okay, that means during this time period the microorganism will adhere and evade the host defense mechanism. Okay, and start causing damage of the host. And there are 3 important factors that determine how long the incubation period would be. Okay, so those 3 properties are, I think you can guess what properties I am going to tell about. So one property is ID50. We have discussed about ID50 in earlier videos, that it is the number of microorganisms that is necessary to cause infection in half of the host, isn't it? Then the second point is the immune status of the host. If the particular host here is immunocompromised, then incubation period will be smaller, and if it is not, then bacteria takes some time to evade the host. And the third point is the virulence factor. Okay, virulence factor means the quantity of the pathogen, right, and what kind of things that they have to cause the infection. Okay, so there are those 3 factors: virulence of the organism, the ID50, and the immune status of the host. So this is the incubation period that I have told you, that this period represents the time between initial infection and the first sign of the disease. At this stage the pathogen, following different stages such as adherence, evading host cell defense, and is beginning to cause damage to the host. Okay, the length of the period is depend on virulence of the organism, the ID50, and the immune status of the host. Now let's move on. Okay, now let's move on the next step or next stage of the disease, that is the prodromal phase. Okay, the prodromal period. This prodromal period, in that prodromal period you can observe some mild sign of symptoms such as say acute pain. Okay, and HS can found. So that is the prodromal period. You can observe mild symptoms such as itches and pain. Okay, now the third period, that is the most important period, that is the period of illness. In that period the microorganism start growing rapidly in exponential manner. As you can see, the graph is now rising exponentially, and during this time the symptoms become well developed. Okay, followed by pain, headache, gastrointestinal disturbance, and digestive disturbance, along with the various kind of symptoms that is associated with that particular microorganism. Okay, and during that time the microorganism starts secreting enzyme and toxins to cause damage of the host, and it is also the time in which the host system become alerted towards that yes, there are some pathogen inside, so we have to on our immune system, right, to fight against those invading pathogens, right. And this is the time when our host body system alerts about the evading host. Okay, not only that, there are also part that this is the period in which the medical practitioners also have to apply drugs. They applied drugs during that period, that is the period of illness. Okay, so this is period of illness. This represents severe stage of the disease. The microbes is undergoing exponential growth and producing the enzyme and toxin resulting in cell damage. At this stage, the signs symptoms are well defined, including fever, chills, muscle pain, light sensitivity, sore throat, enlargement of the lymph node, gastrointestinal disturbance. So, as this period, sorry for that. Okay, as this period, the progress, at this period, the host defense is activated and a defense is mounted against the invading pathogen, and in addition the drug may be administered at this stage. We have to apply drug at this stage. Now let's move to the next part. In that time, the number of microorganisms is slightly decreasing exponentially, along with the symptoms, outward symptoms and side also dissipating. Okay, and the last part, that is the period of convalescence. In that period, you can say it is the recovery period in which the host gain its stability, its strength, and slowly recovering from the disease. Okay, so that is the two last period of decline and period of convalescence. So in the period, the outward sign and symptoms begins to dissipate in conjugate with the declining the number of microbes. The patient regain their strength and the recovery is complete. Okay, so there are 5 stages, okay, that occur, that you can find in every kind of infection, whether it is acute or chronic. So the first stage is incubation period. This is the time frame between the initial infection and first development of symptoms, or the first sign or symptoms of the disease. At this stage, the pathogen following different stages such as adherence evading host cell defense and is beginning to cause the damage to the host. Prodromal period. This prodromal period is characterized by mild symptoms such as itches and pain. And period of illness, various things: fever, chills, muscle pain, light sensitivity, sore throat, enlargement of the lymph node, gastrointestinal disturbance. And there are some drugs, or the drugs that we need to apply against that particular disease, we have to apply at that phase. Okay, and the period of decline. In this period, the number of microorganisms declining, along with the symptoms begins to dissipate in conjugation with the number of microorganisms. And period of convalescence, in that period the patient regained their strength and recovery is complete. Okay, so 5 steps that you need to remember. Incubation period, that is the point where all starts. Then the prodromal period, in which the mild symptoms occur. Okay, and then the period of illness, that is the most important period, in which the immune system starts its action against the invading pathogen. All the important symptoms is developed in that period. Okay, and appropriate drug is applied. Okay, then period of decline is going on. In that period, the number of microorganisms is declining. Okay, not only that, along with it will outward the side and symptoms. And period of convalescence, that is the time in which it recovers.